Welcome, everyone. Thank you so much for joining us this evening for this virtual UMiami Health Talk. Our topic tonight is a popular one. We have hundreds of participants joining us tonight for diabetes and COVID-19, what you need to know. It is brought to you by the Comprehensive Diabetes Center at the University of Miami Health System. I'm your health journalist, Ileana Bravo, moderator for the evening's program. We want you to know that the Comprehensive Diabetes Center offers leading expertise from a multidisciplinary team. Our experts develop a customized treatment plan that fits into your lifestyle using the latest advancements in diabetes treatment, including promising new treatments brought through clinical trials. Our UHealth diabetes specialists are ready to care for you, whether it's in our facilities or virtually, wherever you are. And we invite you to learn more about the measures we have in place to keep you safe in our facilities, as well as your appointment scheduling options. All you have to do is visit umiamihealth.org to see your options. Tonight, we are fortunate to hear from 3 University of Miami Health System experts. Each of our panelists will speak on a different diabetes-related topic and answer your questions. First, we will have endocrinology expert Dr. Rajesh Garg, who will speak on how diabetes affects COVID-19 and the risk of infection in people with diabetes. He will address how COVID-19 impacts diabetes control and what to do. Infectious disease expert Dr. Dushyantha Jayaweera will discuss guidelines for vaccinations in people with diabetes. He will describe the different COVID-19 vaccines along with pros and cons for people with diabetes. And lastly, we have certified diabetes educator Lauri Deane, who will share how to stick to your diabetes meal plan during this holiday season while everyone else around you is splurging, and how to put yourself at that top of your list with tips on exercise. Ms. Deane will also cover the risks of traveling this holiday season with diabetes and COVID-19. After each panelist presentation, we're going to poll the audience on questions relevant to our discussion. So we ask that you participate and be proactive and answer the poll questions. They're going to be anonymous. We also are going to have a question and answer session at the end of the presentation. So I want you to take a moment to look at your Zoom screen. At the very bottom of that toolbar, you're going to see 2 thought bubbles that say Q and A, and that is where we would like for you to enter your questions. Some of you have submitted in advance, but if you haven't, there's no problem. There's plenty of time, and our panelists will address as many as we can get to tonight with a large audience. So thanks for being here. And now I am pleased to introduce our very first presenter, Dr. Rajesh Garg, who is a professor of medicine at the University of Miami. Before joining UHealth in 2017, he was an associate professor in the Division of Endocrinology at Harvard Medical School in Boston, where he completed an immense amount of research work on diabetes. Dr. Garg is an internationally recognized expert on diabetes, and he directs the Comprehensive Diabetes Center's outpatient clinics at the Lennar Foundation Medical Center in Coral Gables, as well as at the Diabetes Research Institute in Miami. And he also directs the diabetes program at Jackson Memorial Hospital. Dr. Garg has had a major impact on diabetes care in South Florida and has improved the clinical outcomes of patients with diabetes through his innovative methods of treatment. We are proud to have him as a presenter tonight. Welcome, Dr. Garg.
Thank you so much, Ileana. First of all, thank you all for joining us tonight for this discussion on this very important topic. As we know, it has been on our minds for the last 9 months, and a lot of questions have been asked, so we will try to answer as much as we can. So, trying to advance my slides. Okay. So some of the questions that many of you have asked, I'm going to address over the next 10 minutes or so. This is based on my own experience in my clinic and many of my colleagues. So the first is the risk of getting COVID-19 higher in people with diabetes? And then how diabetes affects COVID-19 infection, how COVID-19 infection affects diabetes control, then is there a difference in type 1 and type 2 diabetes, and can COVID cause new onset infections? So, how the risk of COVID-19 infection is in patients with diabetes? This is something that people had been asking right from the beginning. Um, the data that we have available so far does not show us that if you have diabetes, you are at a particularly higher risk of getting COVID-19 infection compared to the general population. This is based on the studies from people who tested positive with COVID-19. And when we look at that, about 10% people who are testing positive all over the world, they have diabetes, which is around the same as in the general population. So it does not seem that if you have diabetes, you are more likely to get COVID-19 infection. However, if you have diabetes, then COVID-19 infection is likely to be more severe. So people who have diabetes have more serious complications from COVID-19 infection. Diabetes itself is a risk factor for seriousness of COVID-19 infection, and also because many people with diabetes, as you know, have other associated conditions like high blood pressure, heart disease, overweight. Okay, I found this on the web for COVID-19 infection. And they have, therefore, all these conditions, they increase the risk of getting serious illness if you get COVID-19 infection. So about 1/3 of people who died due to COVID infection have in fact diabetes. So what I'm saying is if you have diabetes, it's not that you will get more infection, but if you get it, then it's going to be more severe. Now, why so? Why are people with diabetes at higher risk of getting more severe infection compared to those who don't have diabetes? This is a very nice presentation of what happens when you have diabetes. Presence of diabetes is basically, it's a slow smoldering condition where there is low-grade chronic inflammation that is affecting most of your organ systems. It's affecting your heart, kidneys, nerves, brain, and also affecting the blood vessels. So over that, when you get the acute infection with COVID-19, that's an acute inflammatory process. So it's basically already there is underlying slow going fire, and over that you get a blast of fire, and that just makes it much more severe. Now, this was a study. So in addition to diabetes being a higher risk of severe infection, if you had poor control of diabetes, then the risk of death is much higher. So as shown here, if you have well-controlled sugars, there is more likely that if you get COVID-19 infection, you will survive. But if the blood sugar levels are higher, then the chances of severe complications and death is higher. Now, what about the difference between type 1 diabetes and type 2 diabetes? So most of the studies that we have seen are basically type 2 diabetes. People with type 1 diabetes, they do not appear to have increased risk of hospitalization or death. That's partly because they are younger, they have less chances of being obese or having heart disease. But again, it is well-controlled type 1 diabetes. So it's reassuring in a way that if you are doing really well with type 1 diabetes, then you are not at particularly high risk of getting severe COVID infection. However, we have seen ourselves in our hospitals Many patients who have type 1 diabetes, when during the COVID pandemic, that is because everything was shut down and people were afraid. So they were waiting to get treatment. Many of them were arriving to our emergency departments in severe DKA, diabetic ketoacidosis. So we have seen a change in terms of how type 1 diabetes is affecting people, in the sense that we are seeing more severe ketoacidosis, or when people arrive in the hospital, they have more severe diabetes uh, due to type 1 diabetes. But it's not, if you are doing well, then you will do well. However, type 2 diabetes is a much more serious risk factor for increasing hospitalization, severe illness, and death. I already showed you the death data. Almost 20 to 25% people who get hospitalized due to COVID-19 infection actually have type 2 diabetes. And that's partly also because obviously type 2 diabetes is more common in older age and have other associated conditions that are much higher risk for COVID-19 infection. Okay, so now how, if you get COVID-19 infection, it affects your diabetes control. It's like any other acute illness, only it's much more severe. So if you have type 1 diabetes and it's poorly controlled, then you have higher chances of getting DKA. We have even been seeing people with type 2 diabetes who, when they get COVID-19 infection, they get into DKA. So it's a very high level of stress on the body, and that even people who have type 2 diabetes can be pushed to the edge and get into DKA, diabetic ketoacidosis, or severe complication, acute complications of diabetes. And like any other acute illness, it becomes harder to control blood sugars. Uh, and that's true for COVID-19 infection as well. And also, there are some of the medications actually, like dexamethasone, that we use for COVID-19 infection, that affects the blood sugar levels. Now, this was an algorithm that was developed by our European colleagues during the pandemic. So what it shows is what steps we can take to prevent or protect our people who have diabetes. So the first thing is, if you have diabetes, best is prevention of infection. How you prevent that is taking good care of your diabetes by medications, glucose testing, lifestyle, and continuing your medications. And then the other measures that health agencies have been promoting, like social distancing, using the mask. Now, this was not available at that time. Now, prophylaxis is still not available, but they were anticipating we'll have vaccine, and now it is available. So, taking vaccine, that is, my colleague, Dr. Jayaweera, will be covering that. So, first step is, if you can prevent COVID-19 infection, prevent it, do everything to prevent it. Now, if you still get it, then the two things, glucose control, it becomes really important that you maintain good glucose control. And also pay attention to the other complications or comorbidities that you have, like the blood pressure, the high cholesterol, or any heart disease if you have. So then it depends on how symptomatic you are. If you are asymptomatic, then most of my patients who got COVID-19 infection, they have been treated at home. They didn't have to go to hospital, and they continue their usual therapy, only with more aggressive testing and more careful. Those who are symptomatic but not severe enough to go to ICU or require ventilation, they may be in the hospital, or depends on how severe, so it's a full spectrum. and they may need some adjustments in their medications. And for that, I will strongly recommend you contact your diabetes care provider, because some of the medications may need either to be stopped temporarily or may need some adjustments. If severe illness, then obviously you will be in the ICU and on insulin. Now, this was a cartoon that was suggested for health systems, because we were expecting there will be a lot of people who have diabetes and they will be vulnerable to get this severe infection. And also, there were chances of everything closed down, so medications not being available, or they're not being able to access healthcare. So all this was basically suggestions for countries and healthcare systems. Now, so what you can do, just to re-emphasize what I already said, to prevent and COVID-19 infection and to manage it better, if you do get it, the key points are social hygiene, social distancing, hygiene, like hand washing or using Purell, and mask wearing, and then glucose control. Continue your regular medications, monitoring, especially if you get the infection, then you need to monitor more often and be careful about ketones. Healthy lifestyle, healthy diet, uh, activity. If indoor is not possible due to any reason, then you can exercise indoors. Then stress management, of course, that became a big part during the pandemic. And then importantly, the vaccines, the other routine vaccinations, pneumococcus and flu vaccine. So those are important, that you get your flu shot and get your pneumococcal vaccine if you're due for that. If still, God forbid, you get the infection, then you should follow the sick day guidelines, which means drink a lot of fluids. If you cannot retain fluids, you have nausea, vomiting, then have small sips of water or other fluids every 15 minutes. Stay well hydrated. If your sugar is low, you need some regular sugars, like to treat hypoglycemia. That becomes important in people who are on insulin. Check your blood sugars extra, and if the sugars stay high, then it's important to uh, call your doctor. So don't delay it, because that's what we are watching, that just delaying the treatment has led to many cases of severe diabetic ketoacidosis. And then be aware, if you are using a continuous glucose monitoring system, that the sensors can be inaccurate due to medications or due to illness. And just cross check frequently with finger sticks to make sure it's giving you the correct readings. Now, lastly, can COVID-19 infection cause new diabetes? So there were suspicions initially that maybe if you never had diabetes and you got COVID-19 infection, that it will do something to your pancreas or the beta cells and cause diabetes. We don't have any definitive proof of that. There were some case reports which were suspicious, but after 9 months, nothing conclusive. So I will say I don't have any suspicion that there is a cause and effect relationship. It may be that those people were already mildly diabetic and then they got COVID-19 infection. So it pushed them to manifestation. So the diabetes became manifest because they were so ill with COVID-19 infection.
Dr. Garg, and that leads us to the first poll question of our participants to answer, and that is, if you have a fever and mild cough due to COVID-19, should you continue with your usual anti-diabetic treatment routine? Yes or no? So it is a response of yes. uh, to continue with the anti-diabetic treatment routine. So, Dr. Garg, I think that they did well in responding to that, right?
I'm so glad that you guys were listening to me. That was wonderful. Thank you so much.
Thank you so much. And now we're going to tee up our next presenter, who is Dr. Dushyantha Jayaweera, who has been working in infectious disease for 2 decades and is a professor in clinical medicine at the University of Miami. Dr. Jayaweera was the executive dean for research and senior associate dean for research at the University of Miami Miller School of Medicine. And prior to that, the Associate Vice Provost for Human Subject Protection with regulatory oversight over the IRB and Human Subject Protection Office. He is one of the lead investigators in the Miami Clinical and Translational Science Institute, which helps to ensure alignment of research operations with institutional resources. Dr. Jayaweera has been a principal investigator and co-investigator in many NIH-sponsored studies in infectious disease, drug abuse, and the site principal investigator of many industry-sponsored infectious disease studies. He is the site principal investigator for the Janssen COVID-19 vaccine study, the PCORI-sponsored Healthcare Worker Exposure Response and Outcomes of Hydrochloroquine study, and the Convalescent Plasma to Limit Coronavirus-Associated Complications study. A mouthful. Dr. Jayaweera, welcome tonight.
Thank you very much, Ileana. Thank you, Rajesh, for inviting me and all our Lisette and everybody who has put this together and you help. Uh, my biggest challenge in giving these talks is that little bit how to switch from one to the other, so you understand. So I'll be talking about the COVID-19 vaccine to you and its relationship in context of diabetes. So my talk is mostly on the vaccine. I want to keep things really simple, and I want to reiterate what Dr. Garg just said, that that about the prevention. So my agenda is to talk about COVID-19 infection, how the vaccines work, the COVID-19 trials. I'm not going to go into too much detail, but I can give you briefly what the trials have been going on with, and I answer some questions from your audience, from the audience. So feel free to flood the Q&A, or you can have a live discussion at the end of the talk. So one of the most important things that we learned is that the when we talk, when we shout, we generate aerosols. Aerosols are you hairspray. The particle size are really small. It's less than like a 5 micrometers. So if you take one of your hairs, I mean, I can't remember the last time I saw my hair, but it's like a hair is like 13 micrometers. So this is like roughly of less than 1/3 of the size of the hair, and these are these aerosols. So these can be dispersed all over the room, whereas the droplets, which just like small, much bigger than that ones, just falls on the fomites around people. So this is the important thing about wearing mask, because if you wear a mask, that you can avoid this type of interaction. And if one person is positive, then if both are wearing masks, the risk is very minimal. So this is really important between the COVID-19 infected host and a susceptible host. So whether you are diabetic, if the susceptible host is diabetic, then it's extra important that you don't stay with people who don't wear masks. So that's really important. Then this is an interesting thing about going to dinners. So I think Dr. Garg was mentioning about social distancing, and if you're diabetic, uh, your chances of getting diabetes is no different from other people, but your severity of the infection is higher. So the most important thing is not to get into that 10%. You should be on the 90% where you don't get diabetes. So in this study, what they found was that in this restaurant, as you can see, there are 3 tables. And in these 3 tables, from one person, 10 people got infected. This is in Wuhan, China. So what it means is that if we go out to dinner and we think that 3 tables out, it's nothing going to happen, it does. You do get infected. Sometimes so you have to be careful when you decide you want to go out to dinner, especially if you're diabetic and if you're controlling everything. It's better not to do that right now, and maybe take out and try out to minimize as much as possible going out and having dinner. So having said that, now let's change gears and talk a little bit about how does this virus work. So as Ileana mentioned, I come from the HIV world where I know we looked at the HIV virus, how we enters a cell. It enters through a CD4 receptor. Now, all these viruses enter through some receptor. They somehow find a receptor to get in. So COVID-19 has this, if you look at this cartoon, there are spike proteins which gets attached to the angiotensin 2 receptor in our body. Now you may ask, where do you find them? So they are usually found in the mouth, in the nose, in the eyes, right down the respiratory tract, the GI tract, and it goes right down to your stomach and the lungs. So which means that people who are infected with COVID can present with people with the respiratory symptoms, difficulty in breathing, cough, fever, shortness of breath. On the other hand, you can present with nausea, vomiting, diarrhea, and then you can have, loss of smell and loss of taste. So that's why the symptoms come through. So the virus, once it enters, the virus releases its proteins, the nuclear, the RNA, it's RNA virus. So the RNA tells the intracellular apparatuses in the cell to produce viral proteins. So the viral proteins then get together and form viruses, and they come out. So that's the kind of a life cycle. And this keeps repeating, repeating, and this huge viral load keeps coming out all the time. And these viruses then gets picked up by the immune system. So there are cells that identify something coming from outside. It's like this, the police that look for, people coming from outside, they catch them. And then what happens that those cells kind of show viral peptides or proteins on their surface, which kind of like telling everybody, hey, I met a foreign antigen. Now, these are the features of this antigen. And now the other cells, the lymphocytes, B lymphocytes, T lymphocytes, those are different kinds of cells, will recognize this, digest this, and then produce either antibodies or dedicated lymphocytes to attack the cells, viruses. So which basically means is that while the virus is replicating, it's also informing our immune system, well, this is who I am. And it's up to our immune system to react. So as Dr. Garg said, that if you're immunocompromised, or if you're diabetic, and if you have inflammation where your immune system is working somewhere else, now the problem starts. So the immune system is it uses several tools. So there are things called macrophages. These are like little white cells who can eat up anything, all the junk, like the vultures, they eat up all these things, and it leaves a little bit of antigens. And the lymphocytes, as I said before, the B and the T will look at these antigens and bite them and then produce antibodies. So the antibodies, the antibodies, when you go and do antibody tests, you're looking at the immunoglobulin, IgG. But there are other cellular antibodies which you don't measure. So that's why that, after a COVID infection, so you may do an IgG antibody and it may not be that high, but you cannot say that, well, I don't have immunity, because you haven't measured your T lymphocytes, which with the cellular immunity, which have a pretty good ability to fight COVID infection. So the body defenses against infection is that it takes, for the first time when the person gets infected, it takes several days or weeks for the body to make antibodies. So, it takes about, I'll talk about it later, about 4 to 6 weeks or longer, right? And then what happens is that even if the infection goes away, the memory stays there. So the memory is there so that if next time you get infection, the memory will, come back and make sure that the infection is taken out. But so that's the principle behind vaccine development also. When you give a vaccine, what you're doing is that you're mimicking an infection, but it's not real infection, but it's like an infection to kind of, stimulate the immune system. So as I mentioned, still we don't know how long these memory cells will last. We don't know how long these IgG antibodies will last. That's a good question. We'll talk about it a little later. At least we don't know for COVID-19. We know for H1N1, but we don't know for COVID-19. So when you give a vaccine, obviously it's almost like giving you COVID infection, but it's not COVID. It's just vaccine which has kind of, not the virus at all. It's mimicking. So there are different types of vaccines which I'll come to later. Uh, the, at the end of the vaccination, each one works differently. The body is left with a memory, T lymphocytes and B lymphocytes. That's the goal. You give the vaccine, and the body ends up with memory T and lymphocyte, which will be there to fight next time the bug comes. Typically, few weeks for the body to produce these cells after vaccination, 4 to 6 weeks, depending on the type of vaccines. For example, Moderna and Pfizer, they get 2 injections, so like 4 weeks, 3 to 4 weeks apart. So it'll take another extra 2 weeks. So roughly about in 6 weeks, they are fairly well primed with the antibodies. Uh, so therefore, it is possible person can be infected with COVID-19 just before after vaccination, and then still can get sick. So since it takes about 6 to 8 weeks for the whole system to be completely primed, if you get COVID-19 the day you get vaccinated, you still get the COVID-19. But if you get the COVID-19 2 months, if you get exposed to COVID-19 2 months after vaccination, then you won't get the infection. So you'll be prevented. So let's start with the first one, the mRNA. mRNA means messenger RNA. It contains material from the virus. So it contains the messenger protein, the nucleic acid mRNA in the virus, in the vaccine. So what it does is that it gets into the cell, and it pretends that it is the COVID-19. So body starts preparing proteins and antibodies against this. The body shows, the cells shows off these proteins as if it's infected. It's not infected. It's just getting the messenger RNA, and now the immune system will recognize this as actually a virus, but it's not. So that is the key about this. The mRNA vaccine. So people have asked that, if you take mRNA vaccine, will it change your genetic profile? Absolutely not, because the mRNA does not get into our DNA. It's in the cytoplasm, and it is just there. So as I said, when the cell recognizes the RNA, produce the protein, and then the lymphocytes and all these things come and recognize that and start producing antibodies. So that's the basic principle of Moderna and Pfizer vaccines. These are not really novel techniques. They have been working on this for Zika and Ebola for about at least 15 years. So this is new to Corona, but the technology is always there. So you shouldn't think that this is some scary thing. It's a pretty good thing. In fact, I got the vaccine this morning. So then there are the protein subunit vaccines. So again, what we are trying to do is that we are trying to fool the system by showing something like a virus, but it's not a virus. So you're giving proteins, pieces of protein of the virus, put into the vaccine with some things to boost the immune system called adjuvants, and you give that, and the same thing happens. And that's how the Novavax vaccine happened. It's not yet here, but it is coming. Then, of course, have this Oxford and Janssen vaccine. They are based on the same principle. And also there are a couple of Chinese vaccines, also same principle. So they use a vector. That's it. The vector means like a vehicle. A vehicle like an adenovirus. Adenovirus is a simple cold virus. It's very simple. But it's attenuated. It's kind of weakened. And also it's non-replicating. This time told you cannot replicate. You cannot replicate, and you're not strong. So weak, unreplicating virus, and you put a little bit of the mRNA into that vaccine. It's genetically modified, and now you give that. It does the same thing that the Pfizer or the Moderna or the Novavax do. So if you look at these three platforms, these platforms have different ways of doing things, but the end result is the same. It creates a very robust cellular immunity and a humoral immunity. That means the antibodies and the cellular antibodies. So this is what I was showing about, once you expose, it takes about 6 to 8 weeks. I'm not going to repeat this. So this is the kind of a curve that happens in our body, whether you get the infection or vaccine. This is the type of thing that happens. So somebody, I think one of the questions that asked, how long does it last? So obviously, the studies have just started. I mean, Moderna started in August. I started Janssen vaccine end of September. So the study has been going on for about 3.5 months. And so it takes, I mean, we have to follow them for 6 months. So I can share this information from H1N1 pandemic and how long does those vaccines last? Roughly about 150 days, roughly about 150 days. So it can go up to 180 or higher, but the median is about 180 days. So as the efficacy goes down, the effectiveness the chance of getting influenza risk goes up. So you can see that on the left side, if it keeps going down, on the right side it keeps going up. So you can see that we don't know after 6 months whether the antibodies will be still protective, but we can cross that bridge when it comes to later. So what about the side effects? One thing, and I can assure you that when we develop vaccines, safety is the most important thing. Effectiveness, FDA was happy with 50%. Tony Fauci was talking, if I get 60% efficacy, I'm good. Moderna and Pfizer had showed 90%. Oxford is coming close to 75, and anything above 75% is more than enough for us. But what's important is safety. And so far, the vaccines have been pretty safe. This is the example. I don't want to show you too much details because I want to keep this simple. And the Pfizer and BioNTech, which is very similar to Moderna, the pain, the redness, swelling, mostly it was the pain after the injection. There were no major problems. There was one couple of people have had allergic reactions post approval in UK, and as a result, Pfizer has said if you have major allergic predisposition, don't take the Pfizer vaccine, which is quite right, and you can go with Janssen or Moderna or the Novavax when they come. So there are about another 40 vaccines in development. I don't know whether how many people will have the courage to bring another vaccine to the market, but at least there are about 5 or 6 on the way. So I think that's with my last slide on that. So now let's take some questions. So the question people have asked me is, does it prevent infection altogether or does it prevent serious outbreaks? It does both. That's what's the beauty about Moderna and Pfizer vaccines. Although I am doing the Janssen, but this is already shown in Moderna. Almost 95 people contracted coronavirus. 5 were vaccinated, 90 were on placebo. So you can see the huge difference that 5 people broke through, but 90 people got received placebo. This is highly significant. This is highly significant. After 95 cases, 11 were severe, and all of them were in placebo arm. So which means that not only that it prevents infection, it prevents severe infection, which you really want to avoid, especially in diabetes. So my point is, if you have diabetes, you really should be taking the vaccine so that you can prevent these severe infections. Does the efficacy change based on genetic traits like race? We don't know. That's why we insisted on doing more Hispanic and Black people to reflect the population in the country so that we can answer that question in the future. Should you take it if you already have COVID-19 or have antibodies against COVID-19? That's a very good question, because the question is that if you've already been exposed to COVID-19, why bother taking the vaccine? So, but the point is that we don't know how long it will last. So if we had the COVID infection, say 6 months ago, your antibodies may be slowly weaning off. So if you get the vaccine, you get a nice boost. So I have been telling people, go ahead and take the vaccine because it'll boost your immune system and make your antibodies more durable so that you'll be more protected. Should you still take another recommended? Should you still take other recommended vaccine along with COVID-19 vaccine? Yes, of course. Dr. Garg clearly stated that it is very important to take this vaccine. In fact, there are lot of publications showing that if you in the developing countries where the people have taken BCG, that had a protective effect. The people who had the triple vaccination, polio vaccination, has a protective effect. So if when you take the influenza vaccine, not only that it prevents influenza, but by stimulating the immune system, it'll protect you against COVID because it'll enhance the COVID vaccine effect also. So that's the general idea, that you must take all the recommended vaccines. So the pneumococcal vaccine, 13-valent pneumococcal 13 for people before age 2 years and for people over 60. And people with, you can see that all the pneumococcal vaccines, if you're over 65, you should take it. Hepatitis B vaccine, and if recommended. So these are fundamental principles of how one vaccine will protect against another disease by just enhancing the immune system, especially if you have especially while taking a COVID vaccine. So in summary, so we have discussed how you get COVID infection. We know how the body responds. You know how the body works, and you know what vaccines you should take. And with that, I'll stop and take the poll question. And thank you for your attention. And this is a very important message. The good physicians treat the disease. The great physicians treat the patient who has the disease. One of my favorite people, William Osler, who I love and dear because he's a great physician, and this is what I always try to practice and teach my medical students. On this side, I say that some people don't like to wear masks. In that case, they should be on the wing. Thank you.
Thank you, Dr. Jayaweera. Well said. And let's see how compelling your arguments were for vaccine with this next poll question, and that is, when COVID-19 vaccines become available for you, for others in our audience, will you agree to get vaccinated? It's simple. Yes or no. Tick the box on your screen for yes or no. Almost 100% said yes, with a small percentage saying no. So that will lead us now to our next and final presenter, and that is Lauri Deane, who is an advanced practice registered nurse with the University of Miami Health System, working within the Division of Endocrinology, Diabetes, and Metabolism. She specializes in diabetes treatment, management, and care. She received her master's in nursing at Graceland University in Kansas City, Missouri, and is board certified by the American Association of Nurse Practitioners, as well as the Board for Diabetes Care and Education. She is actively involved with the American Diabetes Association and American Association of Diabetes Educators. Ms. Deane's goal is to earn her doctorate in nursing practice with special interest in clinical research related to latent autoimmune diabetes in adulthood. She believes in working collaboratively with each individual to achieve their best possible state of health. Welcome, Ms. Deane.
Thank you. So topics for discussion, we will talk about how to stick to a diabetic meal plan during the holiday season. 'Tis the season for eating, right? Tips on exercise and staying active, and risks as well as recommendations for travel with diabetes during COVID-19. Okay, sticking to a diabetes meal plan. These are just some tips that I put together. Eat close to your usual meal time. Try to stick to your regular meal time as much as possible. If you normally eat breakfast at 8, lunch at noon and dinner at 5, try to stick to that. If you're eating a meal with family during the holidays and mealtime is not until 7:30 that evening, try to stick to your regular plan and still have something to eat at 5 p.m. And then when everyone eats at 7:30, just have a smaller portion. This is easier on the sugars. It keeps the sugars more steady when you stick to your regular meal time. If you decide to go for one of those desserts, try to cut back on your other carbohydrates rather than have the potatoes with dinner as well as the dessert. Don't skip meals. Don't starve yourself all day saving up for that big celebration dinner in the evening. You want to continue to keep the sugar steady by eating your regular meal times. If you slip up, everyone has a bad day, everyone has a cheat day. Get right back onto your regular schedule the next day. Don't give up. Don't let that cheat day turn into a cheat week or a cheat month. If you have a bad day and don't eat right, just get back on track the next day. Eat slowly, avoid and limit the alcohol, and stick to calorie-free drinks and water. There are plenty of options now with calorie-free drinks and diet drinks. And then study all the food options. Take a look at what all the options are for the meal. If you're eating over the holidays at a family member's house, the meals that they're preparing may not be diabetic friendly meals. So look over everything that they have, make a decision what the healthiest foods are on the menu. Try to choose the healthier foods, and don't feel like you have to eat every single thing that they have because it may not be a diabetic friendly meal. The naughty and nice list. I kind of just did this for fun. So we think about which foods are on the naughty list this year. Starchy or fried foods, foods prepared in heavy creams or butter, white bread, or any refined pastas or rice. There are plenty of other foods we can add to this naughty list. Donuts, sweets, cookies, cakes, pies. And then what's on the nice list? The nice list: fruits, vegetables, lean meats, and whole grains. Okay. And, a lot of my patients, they ask me, what is the best diet for a diabetic? And there really is no such thing as a diabetic diet, but the CDC does recommend the plate method or carb counting. I love the plate method because it's easy. If you just kind of remember this each time you have a meal, this is your plate. You cut your plate in half. You want to fill half of the entire plate with vegetables, preferably green, but if you fill half of your whole plate with vegetables, salad, broccoli, green beans, asparagus, collard greens, there are a lot of options. So if you just remember to fill half of your plate with vegetables, then you have 1/4 of your plate here and the other 1/4. Your protein's gonna go here. And then this is your carb. This is your carb. This is gonna be your rice, your potatoes, your pasta, your bread. This is your starchy food. The amount really should be inside the palm of your hand. So inside the palm of your hand that's how much rice you should have. That's what the portion of pasta should be. So I like this because it's easy, it doesn't take too much effort to remember. Just fill half of your plate with vegetables and then your protein and a very small portion of the carb. Okay, exercise. So these are just some barriers. Why am I not exercising? I don't have the time. I've never been active. I've never been a person that works out. I'm too tired after working all day. I'm afraid my blood sugar will drop, or I'm afraid to go to the gym during COVID, or I can't afford to go to the gym. So why is exercise so important? Well, first of all, it's good for your heart. And we do know that people with diabetes, the #1 cause of death is cardiovascular disease. So we want to have a heart healthy lifestyle, and exercise is a big part of that. Another good reason is that exercise lowers the blood sugar. So one bout of exercise, one brisk walk for 20 minutes will affect your blood sugar for up to 24 hours later. So just one time of exercising is going to continue to lower your blood sugar over the next 24 hours. That's amazing. You know, that's, you know, one of the most natural ways to lower your sugar, exercise. And the recommendation for exercise is 150 minutes a week, okay? So how do we fit that 150 minutes a week into our lives with all of these barriers? Start with just a few minutes a day. 5 minutes, 10 minutes, anything. You've never been a person that exercises, that's okay. Start slow. Walk around the block once a day. Make it a part of your daily routine and find a time of day that's your time of day to do your exercise. Choose the time of day when you're the most energetic. If you're exhausted when you get home from work, that's probably not the best time to exercise. And if you're worried about your sugars dropping when you exercise, check your sugars before you exercise, which is important for a diabetic, to check your sugar before you exercise, and check your sugar after you exercise. And continue, if you're just starting a workout and exercise routine, it's you're going to want to check your sugars more frequently than usual, because it affects everyone differently. So it's a good idea to have those glucose tablets on hand. And as far as not wanting to go to the gym because of COVID, there are so many workouts we can do at home now, on the smartphones, on an Android or an iPhone. In the App Store, there are loads of apps that are free that you can use to track your fitness. They even have alarms to remind you to do your 5 or 10 minutes for the day. And there's a lot of things that we can do at home, like chair exercises, resistant bands. You can fill up water bottles and use those for weights. And swimming, biking, and walking are always great. But find something that you enjoy. That's important. But we want to start off slow, but eventually get up to that 150 minutes a week. Okay. Traveling during COVID. So the CDC, they say still that travelers are at increased risk for severe illness during COVID-19, and all non-essential travel should be avoided, okay? But if you are going to travel, these are some things that you might want to consider before traveling. So the area that you are traveling to, is it a hotspot? Do they have more COVID cases in that area? Will the other people that are traveling with you be within 6 feet apart when you're traveling? Does the state or local government in that area have restrictions? Some states require you to quarantine for 14 days once you've reached that state. So you may want to look at the guidelines for the state or country, for that matter, if you're traveling abroad. A lot of countries require you to have your COVID test before you even board the plane. And you also will want to look into the airline policies. Some of the airlines were not booking the middle seats. I believe a lot of them have started filling the planes during the holidays, but there are still some airlines that keep that middle seat open. So you may want to research that. And then during the 14 days before you travel, stay home, try to, not visit with friends or be around people that you don't live with. Try to stay home. And if you do travel, these are some tips. We all know wear a mask, but please wear your mask correctly. We don't want to wear the mask like this. And we don't want to wear the mask like this. And the mask also needs to cover the chin. So this is also incorrect. So the mask has to cover the nose and the chin. Dr. Garg discussed getting the flu shot, stay 6 feet apart, hand washing, avoid touching your face. Consider getting tested for COVID before you travel. That wouldn't be a good thing to already be infected with COVID and travel and infect other people. And we went over the local travel restrictions and airline. Pack more of your diabetic supplies. It's always good to have extra insulin, extra supplies when you're traveling. I always recommend that for my patients, even when it wasn't the pandemic. And pack, maybe some gloves, hand sanitizer for sure, disinfecting wipes, and cleaning supplies, okay? And that's all I have for this evening. Happy holidays, and thank you for listening.
Thank you very much, Ms. Deane. Excellent information we need right now on the cusp of the holidays. So I think we're going to launch right into our Q&A because there are so many coming at us and we want to get in as many as we can. So let me tee this one up for Dr. Jayaweera. Will or should patients with type 2 and other risk factors, 65 and over, obese, hypertension, immunosuppressants, be elevated to a priority status for the vaccine?
Absolutely. I think they should be given. It's not that, it's not that some of these, as for diabetes, as Dr. Garg said, that you're not higher risk, but you're higher risk for severe disease. So I think they should be elevated to a higher level.
Ms. Deane, this is someone from the staff who actually asked how she can access diabetes education for pre-diabetes. I'm sure that you're going to put that up afterwards and communicate directly with them because it's important. They're interested in knowing how they can help people with pre-diabetes to not become full.
Well, if it's for a patient who is hospitalized, you can contact the diabetes service for a consult, and I would be the one to see the patient inpatient and to give them a diabetes education. For outpatient, you can call the number that we'll give at the end of the presentation, and we have dietitian and certified diabetes educators within our department that you can make an appointment.
Dr. Garg, can high glucose induce ACE2 expression and facilitate more infection?
That was one of the theories, but nothing that we have seen clinically or scientifically proven. So there are all types of theories, but theory is theory. Does that become applicable? So we don't have any scientific evidence.
Dr. Jayaweera, the CDC guidelines mention those on blood thinners should tell their doctors before receiving the vaccine. Why? And this person wants to know whether to stop the blood thinners.
No, I don't think it's a good idea. I mean, because it's an intramuscular injection, because you're worried that it will bleed into the muscle. But the type of needle we use is so tiny that I don't think it's a issue I don't think stopping the blood thinner would be more dangerous than getting a little, you know, potential bleed.
Okay. And here's a question still for you. How long does COVID-19 immunity last post positive test? And what's the best expected immunity time frame? I know you touched upon some of this if you have the answers.
Yeah, so the answer is difficult to predict because the studies are ongoing, so we can only extrapolate from the H1N1, that type of infection, infection. So we predict about 5 to 6 months of immunity. You're asking, the question is about the infection or the vaccine?
I think it's the vaccine.
Vaccine. Oh, so prediction is at least 6 months. But we will know more information because all these studies are followed for 2 years. So we are hoping that when we follow these people for 2 years, we will gather enough information to give a very meaningful answer how long actually it protects.
Dr. Garg, we'll tee this one up for you. Is the COVID-19 vaccine safe for diabetics that are kidney, liver, or other organ transplant patients?
Yes. So, in the largest clinical trial that was the one that is available now, Pfizer clinical trial, there were around 40,000 people who received vaccine in the trial. Out of that, 20,000 received vaccine, 20,000 placebo. But were there patients with diabetes included in that study? The answer is yes. They were almost in the same proportion as in the population. There were 3,000 people who were included in the trial, 1,500 who got the vaccine, 1,500 who did not. Now, the people who got the vaccine, um, so they were protected compared to those who did not, the other 1,500, to the same extent as those who did not have diabetes. So that answers part one. That is, if you have diabetes, doesn't I haven't answered the transplant question yet. If you have diabetes, will the vaccine work? Yes, we have good evidence it does. Now, if you have liver or kidney transplant or something else, so you're immunocompromised. So we know that the immune response can be slower or more difficult. We don't have any data specifically on COVID-19, but maybe Dr. Jayaweera, you can give some more insight into, do they need higher doses or do they need third dose? I don't know.
Yeah, so it's up in the air. You're quite right, Dr. Garg. One of the things we know is that, say, if I've done studies with flu vaccine in HIV, and we've seen that the response is slightly lower, even if your HIV is well controlled. So, and same thing with hepatitis B vaccine. So, I think your response would be slightly lower, but it's better to have a low response than no response. I mean, you must take it. Now, as you said that we may have to give a higher dose, like, for example, people who are older, when you give the flu vaccine, we give a high dose vaccine because to get a better immune boost. So maybe with those people that such strategies would be tested in the phase 4 studies.
The final question is from Ms. Deane, because I think you gave a presentation talking to us about what we should be doing this time of year, and especially for people in this category of health. And that is, what is the diet if you have both diabetes, coronary artery disease? I think we know what you're going to say, but I think it's important to do this take-home message as our final question of the evening, because we've gone over our time because the questions have been wonderful. But please take us home, Ms. Deane.
A person with diabetes should eat a heart healthy diet. And a heart healthy diet is eating the healthy fats and not the unhealthy fats. Okay. The unhealthy fats like bacon, butter, things like that. The healthy fats are the avocado, fish, nuts. So I think all diabetics should follow the heart healthy diet as well.
I think that your advice, all three of you tonight, has been invaluable to the people in our audience, because clearly it is a topic of high interest. So we regret we've come to an end, but we got in as many questions as we could, and we thank you so much for participating. And for our expert panelists, thank you so much for your brilliance, insight. It means a lot to the patients tuning in tonight. And of course, we at the University of Miami Health System and the Comprehensive Diabetes Center appreciate all your participation. Here are the numbers again for you to schedule visits: 305-243-3636. You can be cared for at 2 locations, the Lenara Foundation in Coral Gables and the U Health Diabetes Research Institute in downtown Miami, the area where they've always been. And please go to umiamihealth.org to make a virtual or in-person appointment as soon as possible. Thank you to all of you. Complete the survey at the end of this, and please stay safe during this holiday season and beyond. Thank you all.